Thanks for joining the People of Precision Health podcast, a series by Vibrant Health where we discuss the unique challenges of building human cohorts for health and clinical research. We talk with experts in population genomics and precision health to explore novel methods and real solutions for engaging the humans behind the data. Dr. Katherine Tossas is a cancer epidemiologist and an assistant professor in the Department of Health, Behavior, and Policy at Virginia Commonwealth University School of Population Health. She is also a member of the VCU Massey Comprehensive Cancer Center, where she is the founding director for the Office of Catchment Area Data Access and Analysis. Dr. Tossas' research is grounded in health equity and centers on elucidating the role of the microbiome on birth outcomes and on disparate progression of precancerous lesions, specifically in the cervix and lung. She is a principal investigator for multiple foundation-funded, community-engaged research projects addressing systemic or structural inequities in cancer outcomes across Virginia. Dr. Tossas also provides mentorship opportunities to students through her Cancer Outcomes Queries to Understand Inequities Lab. Welcome, Dr. Tossas, to our podcast, People of Precision Health.
Thank you, Molly. Thank you for having me.
I am so excited to have you today, and I can't wait to uncover a lot of details that I'm so thrilled to talk about with you today. I want to start with your journey to where you are focused in your research today. The work that you do in increasing health equity is critical, but I'm sure you've had to overcome many obstacles to success. Tell me about your journey.
Sure. So I am born and raised in Ponce, Puerto Rico. I am the first in my family to go to college. So I am, oftentimes I say I am the first to to go to college, the first to leave, all of that kind of stuff. And, all of those things have worked comprehensively to get me to where I am. But it's interesting because now the way that I frame my journey is to say I was advantaged enough and fortunate enough to be disadvantaged and to have the opportunity to learn and from and grow through those. And so those inform my research, my work, and my views for sure.
So how would you say that your ethnicity and race inform your research work broadly and your work as it relates to catchment area data access and alignment, as well as community engagement?
My race and ethnicity, they inform everything that I do, right? So we all see, our lives and our work through the length of our experience. And, I am an Afro-Latina woman, again, first generation. I certainly, I say Disparities is not only like what I do, is part of who I am. I experience a lot of the same issues that some of the communities that I work with experience in my own skin. I am an only child born out of a mother who was diagnosed with cervical cancer at the age of 33, and hence I'm an only child. I grew up in an area that, we grew up, we're food insecure, exposed to high structural violence, water contamination, poor infrastructure, all of those things. And so when I think about these issues and when I look into these issues, perhaps I look at them through that lens, or they are very, very forward in my mind. I don't have to necessarily read in the literature how they impact. I know in my skin how they impact. I grew up, for example, during a time where water was not yet like fluoridated, and I remember coming to this country and having to have a lot of like dental work. And at one point, a dentist asking me, "Well, where did you grow up, and how old are you?" And coming to the realization that like, oh, well, you do know that during that time, water was not fluoridated in that area, and therefore, and you're like, oh. So all of those things certainly inform the work and the research that I do. And this is not to say that to do the kind of work and research that I do, you need to have gone through those experiences. They just put the experiences into a different perspective. So when I talk about things that I don't talk about them in abstract, I talk about them from firsthand experience. And although I understand the value of putting a p value behind my experience, I don't need the p value to know how those experiences get under your skin to change your biology.
Yeah, but I think your perspective is so valuable to people. We take so much for granted in a lot of communities, really across this country, and to be collaborating with people who have experienced what it means to be exposed to lower level infrastructure, things that are not as available to families. Having that perspective is a powerful way, I think, to educate people about opportunities to improve and real actionable opportunities to improve access, and especially when it comes to research and healthcare.
Absolutely. I think some other things that I've learned too, and that I talk about this. For example, I just received my first National Cancer Institute award, and that award, you have an opportunity to write about your experience. And I remember part of my writing about my personal statement was to say, right, I share some of it. I grew up in a place that was very impoverished. There was food insecurity. There was structural violence, there was violence, all these things. But when we would go to the doctor with my mother, who had diabetes, high blood pressure, suffered from obesity, we were exposed to secondhand smoke, but nobody asked, right? Those things were not asked during that time. And to this day, when we talk about social drivers, social determinants, we can say it from the mouth out. But oftentimes, there are still many places where that is not even asked. And so we have a lot of people still to this day that are, in a sense, underdiagnosed, that are suffering through those conditions and exposed to those conditions. And we still don't know. So we still have a bit of a ways to go.
Oh, absolutely, we do. And so I think that the very first step is having these conversations and bringing information and opportunities out of the clinic into the community. And so with that, I want to ask you about a project that you mentioned to me last time we met. I want to make sure I get this right. Chickahominy Truth Project. It's a very powerful example of the interplay between community engagement and research that can make a real impact in populations, in particular Indigenous populations. Tell us about that project. Tell us the background of it and about this community that you are working with.
Yes. So the Chickahominy Truth Project is a really, really special community engaged research project that I co-lead with Dr. Maria Thompson, who is a colleague in my Department of Health, Behavior, and Policy, now under the School of Population Health. And it came about actually as a community concern. So I'm a cancer epidemiologist. My colleague, Dr. Maria Thompson, is a health communication specialist. And this just came about because a community member was having a conversation at an event with someone else and said, I've been really concerned. There's a lot of cancers in my community. And every time I go to church, somebody else has died from cancer. My mom just died from non-smoking, from lung cancer. She was never a smoker, and she walked 2-3 miles a day. And that person happened to know the Massey Cancer Center, and they said, "Oh, there's this young faculty there. Her name is Dr. Tossas. You should talk to her. She may be interested." And so she connected us, and we talked about it. And when she came to talk to me about it, she actually mentioned the word cancer cluster, that she was concerned that there was a cancer cluster in her community. Anybody who knows about cancer clusters know that cancer clusters are pretty tough to demonstrate, to kind of prove, in a sense. And I am not an environmental epidemiologist. She had a concern that there is a landfill in her community, and she was wondering if perhaps contamination from that landfill in their waters, in the drinking water. This is a community that is over 85% in well water, could be perhaps part of the culprit as to why her community had so many excess cancers. And I said to her, I'm not an environmental epidemiologist, but at least if you bring me the cancers, if you want, I can make you a nice map. I can, look into the cancers in your community. And as an epidemiologist, I can talk about the epidemiology of disease. Well, I requested the cancers and I did put them on a map and, did some calculations. And indeed, it looks like the cancers were somewhat clustered in an area. It looked like, there were excess cancers or cancers in excess of what would be expected. So that kind of piqued our interest. So we ended up, writing a grant. Now, again, we're not investigating here cancer clusters, but what I thought was really interesting about it was that the community had a concern. And what I always say is that concern deserved to be interrogated. This community has a heightened perception of their cancer risk. So we wanted to interrogate that and wanted to learn about their cancer knowledge, learn about their health behaviors, and that's what we've been doing. And so we work alongside them, and the project is called the Chickahominy Truth Project, and Truth is an acronym that we developed together that stands for Trust, Research, Understand, Teach, and Heal. And they developed a logo for us, which is really beautiful, representative of the project. And, trust first, because as you know, there are a lot of really poignant and well-deserved reasons why a lot of community member has lost trust or has diminished trust for healthcare, for health research, for scientific research. And so the first step here is to acknowledge their trust to us and to earn their trust. And we do that by collaborating and developing this project together. So in everything we did, we were informed by the community. We literally co-created and co-wrote this project. The project entails going into the homes of about 150 families within Charles City County, Virginia, and within a 4-mile radius that we identified as the area where the cancer cluster, is more prominent, or the excess cancers are more prominent, and then doing a more broad county level survey to learn about cancer risk factors, behaviors, knowledge, and perceptions in general of cancer risk. We do so alongside community members. So in the spirit of community engaged research and community-based participatory research, we have requested that they partner with us and we train community members to become IRB trained, we train them in qualitative interviewing, and we go in pairs, a community member paired with someone from the VCU staff or student. And we do and conduct a 90-minute, about between 45 and 90-minute interview at home to learn about, cancer risk perceptions, healthcare knowledge, et cetera, and conduct water testing, to test the safety of their well water, which are results that they receive. And eventually, at the conclusion of the project, we are hoping that we can take these results and provide them with this collective results, and the community can decide what they would like to do with the results of the project.
Wow. So I talk to cancer centers in a lot of leadership in population health, in catchment area outreach, pretty much every day. And you have to know how unique and special this is. There are so many research leaders, I think, that are not seeing success with activating the community. You're doing an amazing job and an amazing service to researchers, I think, by building that trust. But I want to know, what are the opportunities that researchers, particularly in cancer centers, need to be looking at to engage populations, to empower populations? Because I hear this daily, that we are having a hard time reaching Indigenous populations, or we are not able to mirror the ethnicities of the patients in, or potential patients in, our catchment area. What would you suggest to these researchers?
it's really interesting, right? I want to make a quick point here, and this is perhaps a personal preference, but you know, I hope you hear me out here. I always say that my job is not to empower the community. I don't empower the community because the community empowers itself. My job is to align with the community's power, to stand alongside them so that they, in their power, make decisions as to what they want to do. So, I don't empower anybody, and I would discourage researchers to come into a community to empower anybody. But rather align with folks' power. So that would be one thing. But I think the other thing too, as you know, we talk in the field, and there's a lot of body of research talking about what become now kind of buzzwords, which are like cultural competence, right? There's first cultural awareness, then there's cultural competence, but I think most important is cultural humility. And so I think that to remove the cultural and keep the humility, I think to have the humility, to know what you don't know, and to know that as a scientist, Dr. Wynn talks about this bilingualism. Robert Wynn is our Cancer Center director for the VCU Massey Comprehensive Cancer Center, and he is, a leader and a huge proponent, and pretty much the author of this concept of this bidirectionality between the bench and the community, and how, I extend that by saying that the community should not only be engaged, but it should be integrated. He talks about how, folks talk about being at the table, but he says, centerpieces are at the table, right? They have nothing to do with the crafting of the menu. They do not partake on the food. So, what does it mean to have the community at the table? What does it mean for the community to be at the table? So the point about it is that as researchers, I think one of the first things we need to practice is that humility, right? That if you're not from this community, don't come in pretending like you know what you don't know, right? Because you don't know what you don't know. So come in with humility, come in with flexibility. Oftentimes, we have to recognize as researchers that just by virtue of coming into a community and being the person that comes in with the idea and the funding, there's a power differential. And we have to acknowledge and redistribute that power, figure out how to acknowledge and redistribute that power. And for that, you need, again, humility, right? So one of the ways in which, for example, I acknowledge and redistribute that power is by sharing resources. And what I mean by that, and this is not very popular in my community and the research community, is equal financial resource sharing. So when I get a grant, we work on the grant together, and that is not easy, and it doesn't always work well, right? Equal resourcing for equal power and equal exchanging of intelligence. So that's another way in which you come to the community and you also earn their trust, because you are recognizing their work and the community's intelligence. And then also flexibility. So you have to practice a level of like nimbleness, right? To know that just as you allow for your research aims to change, just as when you do basic science in the lab, and if you propose to develop a mouse model to do XYZ and that mouse model did not work, you have to figure out how to report that, and you have to pivot. In the same manner, we have to practice that same level of nimbleness and ability to pivot in the community, to recognize, for example, that if something is not working, that we are okay with their advice and helping us in figuring out how to rework it. I think that hopefully those three things are valuable and are an extension of some of the conversations that we're having, but I think there are some of the conversations that we need to have more, like being nimble and being okay with things changing.
Some very powerful comments that I think we all need to take to heart. And I think you had an example of a time where one of your study staff had made some assumptions about the indigenous people and their religious feelings about the environment, and had to react to that.
so we had a colleague who was developing some questions to sort of further interrogate this concept of cancer causal attribution and, learn about the spiritual aspect. And in the development of those questions, of course, they were inquiring or interrogating the spiritual practices of like animists, for example, that oftentimes in what we see in some Native American communities in the Northwest, for example, that may be more likely to have different practices around, feathers, their spiritual beliefs around feathers and, forest and animals and things like that. And when we came back to this particular Native American community and we showed them those questions as we were developing, those questions did not resonate. Those were not part of their spiritual practice. And they were like, we don't know what you're saying here because we're Christians. So, they used Bible concepts, Bible principles, right? So it was very different. So it was a great moment of humility and that sort of practice of pivot that I mentioned, right? But especially a humility to say, oh, I made some assumptions and those assumptions did not resonate with this particular group, which is just a really great example of how, we cannot generalize, right? So here's a Native American community and practices differ as well. And we need to allow for that, to rise to the occasion. And we wouldn't know that if we did not have, again, the humility and foresight to bring these questions to the community and say, do these make sense to you?
Yeah, I think that's so important because, like you, I have Hispanic heritage. And I heard a comment once where a member of the community said, I'm tired of seeing every image of Latinos represented with food. There's more to us than that. And I think that this ability to be humble and learn and get people out of the lab and into the community to build these relationships and understand is important. And in particular, I would like to know your experience. We've been talking about one population, but let's talk about the Latino populations that are very diverse across this country. And although we're looking for ways that we can uh, replicate and repeat certain strategies as researchers, knowing that we need to be humble and approach it as a case by case basis, what do you think works really well for researchers in reaching Latino and Hispanic communities for their research programs and in their catchment areas?
So this is really funny because a moment of levity here is that, so again, I'm Puerto Rican born and bred, and I call myself Coqui, right? I'm, graduated from the University of Puerto Rico, came here, grown for grad school, never intended to stay and ended up never leaving. But everybody from my family is still in Puerto Rico, except for my father who lives in Houston. So I sort of attribute a lot of my behaviors, right, to like all Puerto Ricans in the island, right? I'm loud, I speak really fast, I like dancing. And over the years, even my own, they're like, I think that's just you, Kathy. And I'm realizing too, that's some of my own behaviors are really a reflection of my family, right? Not of all Puerto Ricans' families. Not all Puerto Ricans speak really fast. Not all Puerto Ricans, their entire family, likes to dance and every birthday party becomes a festival. So that's more my family. So now I'm recognizing, this is part of my own bias. And so I think that it relates to the question that you're asking, because I think that in reaching the Latino community, exactly, we need to understand and leave our own stereotypes at the door, or rather recognize our stereotypes and sort of figure out how to work through those, right? That to come, once again, the concept of humility comes up. So what is that we need to learn about these folks? We also beyond the recognition that we are not a monolith, right? There's another aspect that I think we recognize less, and that is that so let me just throw here an analogy. I work on the microbiome, and when I talk about the microbiome, I said the microbiome is spatially and temporally dynamic. And I would like to say that cultures likely, in particular now my Latino culture, we too are probably spatially and temporally dynamic. So our heterogeneity, right, is spatially and temporally as well. In other words, I need to, if I were to go now to work in Puerto Rico, which I'm planning on doing, I really need to let go of whatever stereotypes I had of the past, of the Puerto Rico that I knew in the early 90s before I left the island, to the Puerto Rico that I'm encountering now, which is a very different Puerto Rico, probably culturally, than the one that I left. And so I think that one strategy for recruitment and engagement will also be that recognition. Same thing when we talk about the Black community, right? African American community, about same thing with Native Americans. We just give an example that folks are not only that are not monolith, but that they're spatially and temporally dynamic.
Yeah, an excellent way to explain that. And I do think that this understanding, reaching this understanding between cultures will benefit everyone in the research community. But I do also recognize that there are many who may have had a different upbringing and feel uncomfortable engaging in the populations that they want to reach. How do you translate these concepts to colleagues, perhaps, or collaborators? How do you equip people with a different upbringing and background that may feel cautious um, collaborating with or reaching out to these communities that may have a history of distrust with the research or medical community, or may just be very, very different from the researchers that are trying to reach them? How do you coach and equip those researchers? Bridge the I think they call it cross the chasm.
So how do I connect my brothers and sisters and the basic scientists, for example, that are often more distal from this work?
For scientists that have a different background, who may be white, middle class, upper middle class, and oftentimes they feel ill-equipped, they may even feel uncomfortable, even though they want to reach underrepresented populations.
Yeah, so I think I got the gist of the question. I think, Molly, what you're asking is, right, how do we translate this for scientists, right, that are, for example, from the majoritized group, the white community, right, that want to do this work? How do they engage in this kind of research in a way that is culturally aware, sensitive, and humble, that they can do also meaningful work? Absolutely. Listen, here's what I say, and I'll give you the sort of really political answer, as in power to the people answer, and then I'll get a bit more scholar, I guess. I say to my white brothers and sisters, I say we need one another. Racism and discrimination exist. They are real. They are not your individual fault. They are our collective history and responsibility. Does that make sense? And so we have to first and foremost acknowledge that. And I think that acknowledgement is really important, especially for my white brothers and sisters. That's one. And so with that acknowledgement, you come in once again, the word of the day is humility, right? With that kind of humility and knowing that the expectation when you come to do this work is not that you understand, right? The circumstances. Is that, again, you have the humility and the awareness that you don't understand, but you want to learn about it. And so then surround yourself with other scholars that perhaps have a better understanding, have the humility to bring in be community forward, community facing, community first, and bring the right kind of partners and elevate, for example, members of the community that you are interested in serving through your research, right? So that they can help inform those research questions, that they can help inform your design. So I think that those would be my sort of simple tidbits for my white scholar brothers and sisters. Again, humility forward. Know that the expectation is not that you know or understand, and please don't pretend to understand it. It is okay, right? You are here to learn alongside us, right? But bring and elevate the voices from those communities so that they can help inform your research and your research question. Also, know when to step aside. I think that's really important, regardless of race, by the way, but just also know when to step aside and when to allow that other voice. For example, in my work with the Chickahominy Truth Project, it is incredibly important that we, as much as possible, try to go to the house of a community member as a dyad with another community member. I'm not from there. I ain't got no business going there by myself. I don't know what I'm talking about. When we are together in a room and we are presenting, and my colleagues from the Chickahominy tribe are present, I defer to them. They have the expertise, not me. I can provide them the data if they want around the numbers that I'm finding, but they are the experts, not me. I am just here presenting some numbers. They can contextualize. And so I think that the same applies to, scholars that come from different backgrounds that want to do this work. I also would like to take this opportunity to say, in general, this not only applies again to white scholars, but for scholars that want to do health equity work, that want to do health disparities research, to understand that this is a legitimate science with the kind of scientific rigor, the same scientific rigor as those folks that do bench science or that do translational science, that do clinical trials. And so that they practice respect for the expertise and respect for the training that it takes to do health disparities research and work, that there are metrics, right, that have been validated, that they are methodologies, that they are grounding frameworks. And so to have respect for that scholarship, and that before you call yourself a disparities research, or before you want to do this work, that you really understand what exactly does that mean and the kinds of methodologies that exist.
That was a whole other lens and to this conversation. And what you're talking about is truly collaborating.
Yes.
Collaborating in many different ways to achieve that scientific aim. And I think it's a great segue to talk about the role of data, because we have a lot to explore, I think, with regard to not just the work you're doing in the community or to reach communities with particular research, but to apply data sources, and digital methods to your research. And you're talking about scientific rigor, metrics. Let's unpack that a little bit and talk about the role that data plays in reaching these communities and studying health disparities.
Yeah, absolutely. So I'll give you an example of something that just happened today. And I think I talked about it earlier when I was saying I didn't need a p-value to know that, in my community I was food insecure or whatever. But if it makes you feel better, I'm happy to get it. And so earlier today, I was in a meeting talking about Charles City County, and the community was speaking. They were presenting around their general what they feel are the main issues of the county, et cetera. And the main issues that they were expressing that are happening on the county, of course, I was asked to prepare a presentation of our summary of our data thus far, and the themes that are emerging and the things that I'm finding from the data. And so they presented before I did. I had no need to present because what they shared is what I'm seeing on the data as well, right? And so
Yeah.
I was asked to summarize the meeting in one word. What word would I use? And I said affirming. I had no need to share my data. I said humbly, if you want to see it, I can show it, but my data simply puts a p-value on what you just said, right? So I think that data is important for sure, especially for those of us that have made a career in the sciences. It has a value for sure. It is incredibly critical to make sure that we kind of certify that this is indeed a problem, and that in fact, if I invest resources in addressing this problem, I am going to improve the outcome of interest, right? So it is incredibly valuable, and it's incredibly important that we design experiments that are scientifically rigorous, that we make sure that if we're going to make some causal claims, that we have our ducks in a row. All of that is really valuable. But again, know that sometimes the community intelligence also is incredibly valuable. Make sure that you are assured by that. I think one thing around data that I would like to say is that we in the scientific community still need to evaluate and still need a paradigm shift about what data is and what data is not. We all live in this whole concept of the streetlight bias. We need to recognize and understand and sort of accept in our faces that our very research questions, the way in which we design the research questions, which choose to illuminate this area right here based on what we want to interrogate, is in itself a bias approach, right? Because you are making the choice to say that this area right here is the most important, and this other area over here that is in the dark, you have chosen not to illuminate. And so by virtue of that, you are making a biased assumption that this is what you think is more important. You can say it is based on some data, but we have to understand that, right? Then also for people like me, I'm a very quantitative scientist. So for me, data means numbers. For a qualitative scientist, data means words. But we also have to recognize that there's a whole host of other data is nothing but information. And there's a lot of information that we don't capture, which if you ever see me talk, you see me show this picture of the manhole in a mammography facility. And it's a picture that I took many years ago that will go on to transform my career. And I show it because it is an example of a data point that I was blind to, that my forms, my questionnaires, my surveys had no way of accounting for. But the individuals that were working in that institution, when I came in to evaluate them because they were poor performers based on the numbers that I had collected, the technologists that worked there were very clear to point out, yeah, your data is really cute, but your data, yes, of course, you missed the fact that there's a manhole in here and I have to come in to work under these kinds of conditions, but you also miss the fact that your data doesn't account for the fact that I have no adapters to adapt for the size of a woman's breast. I have no way to position a woman that is arthritic or kyphotic or obese. I am missing light bulbs in my light boxes that I cannot order. And so I am sorry that my recall rate is really high based on mammography quality metrics. I am sorry that you say I have a high rate of loss to follow-up, because I don't. So your data is flawed. Your data is missing data points that simply your tools fail to collect.
Wow. I can see why that transformed your mindset. That is an incredible story. But I'm hoping that in a few weeks, we're going to hear more stories and how those individual examples help us to become better scientists, because you're having an event that I do want to talk about on this podcast, a conference, the Catchment Area Data Analytics event in just a few weeks at VCU. I'd like to talk about what is the impetus of this conference. What are you looking forward to? I'm definitely going to be there, and I'm excited about really learning more from you and your colleagues and collaborators and a lot of other cancer centers that will be there.
Absolutely. Yeah. Thank you for elevating the conference. So the conference is the first catchment area data science conference, and it's called, Cancer Catchment Area Data Beyond Definition. And the impetus for the conference is that, as you know, and some of the audience may not know, for cancer centers, and this is somewhat recent, I would say, as of the last maybe less than 10 years, cancer centers have been pushed, cancer centers that are seeking designation from the National Cancer Institute or that have designation have been pushed to define their catchment area, which means where the patients that they serve come from. And that desire was motivated by, in a sense, around this whole conversation of, who you serve, how you're using your money, right? And it was motivated by the fact that there are these cancer centers that get this money, and maybe they're investing it in a cancer that it is of interest to this researcher, but perhaps it's not a cancer that is salient in the community that they serve. So there were, some, different news, et cetera, that would talk about different areas where like the community was getting sicker while these institutions were doing better. And so it's a way of holding us accountable. So as a result of that, through the years, this conversation has become incredibly important, and it's become sort of like this revolution of developing tools and strategies to define the catchment, to generate tools that inform then the research that a cancer center does, the outreach that a cancer center does, the clinical service that a cancer center offers at times. And so that whole field of catchment area data science has really sort of exploded in the last few years. And so the impetus for this is to bring all of those folks together to have a convening and a conversation around, to level set, to see what we are all creating. How do we co-create? How do we move together? You know that in academia, we love our silos. We are enamored with silos. But in our quest, as you know, though, the world, right, is moving towards data democracy, data like openness, data sharing, open source software, artificial intelligence, data integration. And so I think that this is an opportunity for all of us to come together and say, here's all that we have. What are we all doing? How are we all doing it? Where are the commonalities? Where are the differences? And how can we grow together, right? To augment and enhance what we each are doing for the betterment of the folks that we say that we serve, right? Cancer centers are those that are particularly designated, are supposed to be beacons to generate like generalizable knowledge, right? Knowledge that really serves everybody, not just this area, but really to all. And for that, I think that we need a collective, collaborative, cohesive effort. And we're hoping that this conference is a catalyst for that kind of collaborative growth.
Awesome. And I'm so excited that I'm going to be there because Vibrant will be there, and you're speaking my language. But now I want to ask you to bring this back to the community outreach, community engagement, because I want your opinion looking forward, because Vibrant is we emphasize outreach, patient centricity, data collection, and engagement as really a cohesive part of the patient's journey and research. And I want to know where you see roles for Vibrant, for example, and really community activation with digital methods in the next 3 to 5 years. Where's the relevance, do you think? Where are we heading as a research community?
Yeah, I think that a place like an organization like Vibrant is vital and critical in community engagement, right? As we just talked about, no community is a monolith, right? And so this information that Vibrant collects, this approaches that you guys use to measure how we engage community, the intricacies of that, the background of the process of research, that data is incredibly valuable for us to sort of maximize the benefit that our research can have in the community. So I think that you guys are incredibly critical, and we need that information to improve our approaches, to improve our methodologies, right? So, and also to bring some kind of cohesive message, because for example, so I just told you about truth. Those are my lessons, and I have my lessons over here in my little drawer. And so how do I share those lessons? I think platforms like Vibrant are platforms that can come together to basically develop systems so that whatever my lessons are can be systematized and programmed, and others can benefit from those collective lessons learned. So at the next time around, the next project, we do it better. And we can maximize our impact, the impact of our research in the community.
Absolutely, a shared vision. Well, Dr. Tossas, we've had a great wide-ranging conversation today. I'm so grateful I got to have you to myself for a conversation. Thank you again for joining me, and I'm looking forward to this event. Tell us the dates and location just to wrap up.
Yes, the event is going to be December 7th through the 9th. It's going to be here in Richmond, Virginia. We want Richmond to become a hub for cancer data folks like myself. We're going to have the American Association for Cancer Institute, the Association for Community Cancer Centers, and representation from hundreds and hundreds of different cancer centers. So if you have folks that are interested in cancer data and interested in making inferences about data, definitely register for the conference.
Awesome. I can't wait. Thank you again.
Thank you, Molly.
Thanks so much for listening to the People of Precision Health podcast. To join us next time, subscribe wherever you get your podcasts. And to learn more about how we're helping to engage the humans behind the data, visit vibranthealth.com.